Anyone who's going to think of taking part in some research projects should have a look at that, because there's two potential outcomes to your application. Either you're successful or you're not successful. And very often it's very difficult to understand why you're not successful. So having that particular guide is a very good way, just as a check and balance, to say the reason they've been rejected are these. I now understand why, and I'm not put off.
Yeah, because when I went through the process of applying for the clinical trial last week, it was on the backdrop of having read the guide. And as Stephen said, it put into context that I might get rejected. Whereas if I was doing it just afresh on the application, it probably wasn't as clear that there is a sort of rejection process. So it definitely would be beneficial from that perspective. Gives people the wider aspect.
I think the other thing to add to that, Gary, is to understand why the researcher has a rejection criteria. Because you say, look,
Yeah.
I've got Parkinson's, I'm the person you really need to be in this clinical trial. But the researcher's equally got to say, yes, but I'm only looking for females and they've got to be over 60. So that's quite valid for them to have their own criteria. And me as a male over 72, that just don't qualify. But when it gets into the more difficult areas, like, well, actually, because you've had DBS, or because you're on a particular drug, or because you don't have a particular symptom, then that's why we don't want you on this trial, to have that explained to you.
Yeah, and it's quite important if you look at it from an altruistic, wider picture. If somebody applies for a trial and gets rejected, and they don't have the backdrop to why they're rejected, that could just put them off for life, and then that person's lost to other trials that would be more suitable for them. So there's the sort of the bigger picture to make sure people aren't, the guide doesn't make sure people aren't alienated through their experience.